Drug outreach programs are social services available to drug users. In this video, I want to explore what these programs are, their main principles, the specific services they offer, what the work looks like, and whether they are useful, their main advantages and disadvantages, and I will mainly talk about these programs in Czechia, but I'd imagine the ideas apply globally. So what are drug outreach programs? Drug outreach programs are low-threshold programs. Low threshold means that there are efforts to remove barriers that could prevent someone from using the service, and these barriers could be psychological, social, logistical, or technical. This means that very little is required of clients to join the program. There are no mandatory tests, no proof of motivation, no fees, and no need to present an ID or to provide real personal details such as your name. And unlike many other programs that are designed to treat addiction, low-threshold programs do not require abstinence, which significantly increases the range of individuals who can use these programs. Other low-threshold programs you may already be familiar with are contact centers, which I have previously covered in a different video. And the main difference between outreach programs and contact centers programs is that the workers travel to the clients rather than the other way around. They aim to work with clients based on their current condition and their needs in their natural environment such as streets or parks. That would be the open drug scene. And some programs also operate within closed drug scenes that would be apartments or squats. Drug outreach services practice harm reduction. The goal is to prevent the negative consequences of drug use, not the drug use itself. And drug outreach services are defined in the Social Services Act and fall under social prevention programs. They aim to help individuals overcome their adverse social situations and protect society from the emergence and spread of undesirable social phenomena. Specifically, they focus on tertiary prevention and they work to prevent serious or lasting health and social harms of drug use. The idea that banning drugs and not providing programs for drug users will solve the drug issue does not interact with reality. Harm reduction offers a more pragmatic approach to the issue. Drugs exist and people will take them, so let's focus on minimizing the harm to both individuals and society. The harms associated with drug use include, for example, the transmission of infectious diseases such as hepatitis, HIV or syphilis, as well as other health complications like abscesses or infections, and even overdose. Many of these complications can be prevented if clients are engaged in the programs early in their drug life path. The goal of low-threshold programs is to maintain contact with the clients and gradually motivate them to change their lifestyle by increasing their awareness of the risks and by stabilizing their psychosocial situation. And at the same time, these programs protect the public from the effects of drug use, such as discarded needles in public spaces. Low-threshold programs adhere to several principles. This is low threshold including anonymity, voluntary participation, free-of-charge programs, confidentiality and discretion, individual approach, and professionalism. The target group of drug outreach services are drug users, and these users should be 15 or older. These are mostly users of illicit drugs, though in some cases this may include individuals who abuse prescription medication or a combination of illicit and completely legal drugs. In Czechia, common drugs include heroin and methamphetamine, with buprenorphine being less prevalent but also present. There are many different ways people interact with drugs. It can be intravenous users, individuals dependent on psychoactive substances, regular users, or even people who just experiment with drugs. All of these are target groups of outreach programs. Additionally, these programs offer support and counseling to people who are closely associated with drug users, such as family members or loved ones. There are many services these programs offer, and we will go through them in this section. The workers provide practical and theoretical assistance and collect discarded drug paraphernalia. They give clients information on the risks of drug use and how to reduce them, distribute sterile injection equipment, and occasionally provide medical supplies. They may also conduct basic screenings for infections and assist with follow-up care and treatment, and provide information about addiction treatment options and strengthen the motivation for the treatment. Key services include outreach and monitoring. This helps create a clear picture of the local scene, who is involved in what numbers, what programs are in demand, what a local drug scene looks like, and which drugs are prevalent. Contacting potential clients. Unlike contact centers where clients initiate the contact, workers often take initiative in the outreach programs. They identify potential clients and establish contact, for instance by distributing informational leaflets or other promotional materials and introducing themselves and the program. Initial contact. During the first meeting, an oral agreement is made about the service without requiring additional paperwork. Clients are informed about what they can expect from the program and can express their needs and expectations. Individual planning. Workers collaborate with clients long-term on their personal goals and provide services that can help the clients achieve their goals. Information services. Not all drug users are fully aware of the risks associated with drug use. Workers are equipped to answer questions on specific topics related to drug use. Needle exchange programs. For intravenous drug users, the program involves collecting and distributing sterile supplies such as needles, disinfectants, water, or filters. Some programs also offer condoms, and these services are critical for personal and public health. Collection of injection supplies. Workers are equipped to collect injection supplies. They identify and monitor problem areas, and they inspect and clean these locations, which significantly contributes to public health. Crisis intervention. Crisis intervention is provided to individuals that are in need. The goal is to stabilize the client's condition and reduce the risk they pose to themselves and others. Assistance. Clients often struggle with communication and may face self-doubt or discrimination. Workers can accompany clients to institutions and help them overcome these barriers. Healthcare. Basic healthcare is provided by non-medical personnel, which means that most workers can fix minor injuries, but clients are encouraged to seek medical attention if they have any serious health issue. Workers are trained to provide first aid. Case management. Long-term work focuses on solving clients' problems and improve their ability to manage challenges and achieve goals. Motivational interviews. The programs do not force clients to change their behavior, but workers use tools such as motivational interviewing to foster a desire for change and for lifestyle improvements. Referrals and mediation. Clients may need services that are not offered by the program, such as specialized healthcare or social services. Workers provide information and context for these institutions and may assist with connecting clients to them. Phone use. Some clients lack access to a phone, but certain matters require phone communication, such as contacting authorities, family, or employers. The program's phone can be used for these purposes. And finally, testing. Various diseases can be screened for, such as hepatitis or HIV, and the specific tests offered vary service by service, and these screenings do not replace diagnosis. Positive results require follow-up testing by a doctor, which workers can facilitate, and some programs also offer drug and pregnancy tests. And while this line of work offers a lot of direct work, working outside with the clients, it's not just direct work. Actually, these programs require quite a lot of administration. Preparation is crucial, so the workers have to ensure that the bags or the backpacks are stocked with necessary supplies. And even though they focus on working with people, they are not free from administration, particularly if you work in a publicly funded program. Activities need to be documented, such as recording the number of contacts, who was reached, what was the nature of the interaction, and whether the worker distributed any supplies. Workers also need to maintain a list of institutional contacts, handle scheduled visits, and respond to emails. Participation in team meetings and occasional training sessions or a workshop is also a part of the job. The distribution of these tasks varies between organizations, so the job doesn't always require just being in the field all day, and in some locations, field visits might not even occur daily. The workers usually do not work alone, they often work in pairs, and it's preferable to have more genders in the pair. The work is highly specific. Unlike in many other programs, workers of these programs work in the client's environment, not in their own. And they have to establish trust and rapport within the target population, which can be challenging, especially if you work with clients who were previously let down by other services or programs and they approach anything new with skepticism. The workers establish contact with target groups with these three main methods, and that is direct approach, when they engage with individuals or groups through immediate and straightforward contact. Or they can do natural contacts, which means that they go to the location where the clients exist and allow clients to approach them spontaneously. And finally, chain contacts, where the workers engage with a key person within a group and then this person introduces them to the rest of the members of the group. And not all methods are suitable for all individuals or all groups, so the worker must be able to assess the most sensitive and effective approach for each case. Many workers operate within the same area as where they live, which can lead to encounters with clients outside of work hours. Setting clear boundaries is essential, though challenging due to the nature of the service. However, firm and clearly defined boundaries benefit both the worker and the client. Clients of these programs can include individuals who were once integrated into society and have fallen out, or those who have never integrated, such as undocumented immigrants. Low-threshold programs can be kind of a bridge, and they can help these individuals access other programs or services that might improve their lives, such as additional addiction treatment, healthcare, or social programs. And with the help of workers, clients can take steps in rebuilding their lives. For instance, they can obtain documents or visit a doctor. There are situations where clients may face significant stigma or logistical challenges, and these programs never force clients into action. They support clients' own desire and initiative for change. Outreach programs contribute by monitoring the drug scene and improving the quality of affected areas, such as cleaning up discarded paraphernalia. Needle exchange programs, in particular, save public funds by preventing health problems and infections, which are far more expensive to treat than to prevent. In Czechia, having health insurance is mandatory, so if you don't pay for it, there's this growing pile of debt. But even if you don't pay for it, the people are still entitled to medical care. And I also read a very interesting thesis on the motivation of workers, and many workers appreciate the dynamic outdoor nature of the job, which is engaging, useful, and involves a very interesting target group. The work allows them to explore new places and not just sit behind a computer all day long. And sometimes the impact of their work is visible and clients express appreciation, which brings workers a sense of fulfillment. But it's not just unicorns and rainbows. Outreach programs, like other programs for drug users, face stigma, and some people falsely accuse these programs of promoting drug use, which is not true. Outreach programs do not encourage drug use. Instead, they motivate clients to change their lifestyle while addressing clients' current needs and mitigate the harmful behaviors. They don't enforce change, but they don't support drug use. They support minimizing harms. And despite the fact that this job can be meaningful and fulfilling and adventurous, it is a challenging line of work, and workers often carry heavy bags or backpacks filled with supplies, and they spend their entire days on their feet. And the job is mentally demanding, it requires a high degree of emotional maturity, and clients may not always behave ideally. The work is typically on the lower end of the pay range. If you're interested in a list of currently available programs in Czechia, you can check out the map of 8. At the time of publishing this video, the map includes 75 outreach programs. Most of these programs have their own websites where they detail the specific services they offer and schedules for different locations. But that's it for today's video. If you have any questions, feel free to ask in the comments and I'll do my best to answer them. And if you have any experience with outreach programs, whether as a client or a worker, and would like to share your experience in the comments, I would love to read about it, and I'm sure I'm not the only one. And if you enjoy mobile games, you can try my game. I developed a game, it's called Mushroom Match, and it's available on both Android and Apple. I'll put the download links in the video description, and I'd be so happy if you gave it a try. So thanks for watching, have a great one, bye!